And now I will turn things over to Rhonda, who is our RIPT project manager.
All right. Thank you, Faith. I appreciate you getting us started. And I'm going to go ahead and share my screen so I can pull up the PowerPoint for us. And let's see. Anyway, so I am Rhonda Barkus. As Faith said, I'm the program manager for the Rural Healthcare Provider Transition Project, and we do call that RIPT for short, so we don't have to say that whole tagline every time. I really want to thank you for being here today and your interest in applying to be part of the next cohort for the project. As Faith said, we are recording this. We will be sending out the PowerPoint and the recording after the meeting. We're also going to be taking questions at the end. We have a lot of information, but feel free to either hold your questions to ask, or feel free to also go ahead and put those in the chat box if you would like to, so that we don't forget. Right. So the RIPT technical assistance. So this project is actually supported by HRSA and the Department of Health and Human Services through FRHP. And it is with a cooperative grant. This is a 5-year cooperative grant. We are just finishing up our 3rd year. So we have 2 more years of technical assistance that would include supporting cohorts for this. If you're not familiar with the center, the National Rural Health Resource Center, we are a nonprofit, and we are dedicated specifically to improving healthcare in rural communities only. We do not work in metro at all. We've been around since the early 90s, and we're the nation's leading technical assistance and knowledge center. And we focus on those 5 areas: transition to value and population health, which of course this project supports; collaboration and partnership; performance improvement, which this project also supports; health information, technology, and workforce. We feel very strongly about diversity, equity, inclusion, and anti-racism. We have changed hiring practice. We have really looked at our our culture of the center to make sure that we are creating an environment that is very open and welcoming of everybody. We also are working to make sure that DEI and anti-racism is part of all of our programs. And so you will see that a lot if you are part of the cohort, both in the work Stroudwater does and Stratis does. There is a focus on DEI and anti-racism as we're thinking about moving towards value-based care. In a moment, I'm going to share a little bit about the purpose and goal and the eligibility for the technical assistance. I'm going to give you an overview of the technical assistance. So if you're interested, you know exactly what that is going to entail. We have 2 of our past participants from last year's cohort who are going to speak to their experiences with us. We will share more about the project timeline, the application and selection process, and then also, though, other opportunities, whether a person or a hospital or a clinic is part of our cohort or not. There are other educational opportunities available to anybody. This is the RIP team, and Sally Bucks, our CEO. Terry Hill actually created the center years ago and is now our advisor. You met, I'm speaking now. You met Faith, and then Angie LaFlamme, our specialist, will be presenting in just a moment. Our project officer at the federal office is Janine Myers. We've worked with her for several years. She wanted to be here today, but actually was in another meeting she had to attend. So to start off with our purpose and the goal of this project. So the purpose of RIPT is to help strengthen organizational foundations in different key elements of value-based care, and that includes quality areas such as efficiency, patient experience, safety of care. In a moment, you will be hearing from Stratis and Stroudwater, our consulting groups that do the technical assistance, and they will give you a little more detail about that. But really, the whole purpose is to help organizations prepare for value-based care. The goal then is for us to guide small rural hospitals and certified rural health clinics who are not currently participating in value-based care to prepare for and position their organizations to be prepared if they choose to go ahead and jump into value-based care, or if it no longer becomes an option. So it's really just to help prepare organizations for value-based care so they aren't scrambling if that becomes a requirement, no longer an option. I will say that to apply for this project for the cohort, you do not have to it is not a requirement of going into a value-based care, but it is just to prepare the foundation for that. So a little bit about eligibility. So the eligible small rural hospital, that would be 49 beds or fewer, as reported on your Medicare cost report. A rural area is defined as outside of a metropolitan statistical area or located within a rural census tract, or being treated as being located in a rural area. Down below, you see that we actually have a link to the Rural Health Grants Eligibility Analyzer. So if you're not sure if you're rural, you can go to that link when we send this to you, and you can find out whether you're actually in a rural area. The other piece is that the hospitals and clinics can be for-profit, not-for-profit, faith-based groups in the U.S. territories and tribally operated hospitals, as long as they're still meeting the requirements of being rural. So what the ideal candidate, we definitely encourage everyone to apply if you're interested in this. And what we are looking for is candidates with a high need. So those would be candidates that are not currently participating in any kind of TA that's similar to what we're going to be describing. Not already part of value-based care, and maybe don't really have a lot of resources and tools and support to prepare for value-based care. So we're looking for those with a high need. The other thing we're looking for on the other side of that, though, is a strong readiness. And so we define that by being financially stable enough that basically you're not having to worry, how are we going to pay the bills from week to week? Because if a organization's not stable enough to be worried about that, then it's hard to focus on a big project. So financially stable enough to be able to focus on the project. The other thing we're looking for is a strong, stable leadership that's committed to this project. Because as you'll see, there are a lot of different moving pieces. There are some pretty big projects and expectations. So we really need leadership that is committed to meeting deadlines and being a part of this process and really make the best use. We only get to select 5 organizations, so we want to make sure the ones that are participating are making the really kind of making the best that they can from participating. A few things about project expectations. Have to be able to undertake a comprehensive consultation project. And again, strong leadership, able to have internal support for the project. If a hospital or clinic's part of a system, need to make sure that the system will support the project. Organizations have to be able to fully participate in the financial operational assessment and the clinical quality piece. Able to pre-schedule the meetings. We schedule things far out in advance so that we all know kind of what's expected, because I'm sure you all have very full calendars, just like our consultants, and we do as well. Be able to meet the deadlines for any data requests, attend the kickoff webinar, which we'll talk about later. We also have a peer-to-peer learning collaborative for the 5 hospitals in this cohort. So need to be able to attend those. Those are 5 sessions via Zoom. And then also be willing and able to share the successes and the lesson learned, because we do provide spotlights on the hospitals and the clinics that we have supported previously. Technical assistance, those first 2 bullet points, those are the big pieces. So in a moment, you're going to hear from Candy with Stratis Health. They do the quality focused project, and we will share with you all what that timeline is going to look like, what the TA looks like. But it's a pretty big project with where you're really getting to dive down into some aspect of quality. And then Cameron is here from Stroudwater Associates. He's going to talk about their piece of this, which is doing a financial operational assessment to help hospitals and clinics know what they need to do to prepare for participating in value-based care. Then you get coaching to support all of this from both consulting groups. We do the peer-to-peer learning collaborative, which supports the implementation and sustainability. And again, that's 5 sessions. And then we also provide help webinars, which are webinars that are actually offered to everybody. And this is the Stroudwater group. So I am going to hand this over to Cameron to talk a bit about their technical assistance.
Yeah, thanks. So pleasure to see everybody on the call today. As Rhonda stated, my name is Cameron Smith. I'm from the Stroudwater Associates Technical Assistance Team. Just a quick little background on Stroudwater. We're a consulting firm based out of Portland, Maine, primarily work in the rural healthcare space. As you see, our chairman, Eric, is on the project team here. He's had experience doing financial operational assessments such as this technical assistance in 300 plus hospitals. And then additionally, Lindsay Corcoran and Wade Gallen are on this team. They're senior consultants who have a wide array of experience within the performance improvement, operational improvement side of things, and the quality assessment piece as well. And then I have a background in process improvement, which will be factored into this as well. And moving on to the next slide there. So our technical assistance really looks at what we call a strategic, financial, and operational assessment for the organization. And as you'll see on the next slide, when we move to that, we're really focused on what we call a transition framework on a shaky bridge towards the move from a fee-for-service healthcare system to a population-based healthcare system. So the technical assistance with us will really involve a full interview with staff that looks into your readiness to move into a population health type of organization. It'll include a health equity dashboard, but additionally, it will include recommendations against best practices for financial and operational practices within the healthcare organization. So we'll look at your days cash on hand, your overall financial performance, your small provider needs assessment, staffing benchmarks, and also take a look at your service area to see if you're really capturing the market share that you should be. And then we'll include recommendations against best practice. And additionally, there'll be a presentation about what we consider the future of rural healthcare on that next slide, on what we consider this transition framework, which is the movement from this fee-for-service to the provider population-based health system. And it really looks at the delivery systems for operational effectiveness and quality, primary care network alignment, service network rationalization, population health management, and then also a shifting payment system. So we're really focused on phase 1 of this transition framework, but we'll help also strategize and plan for how do we move all the way to a provider-based health plan in the future and that full population health plan. Moving on to the next slide. One of the key items of our technical assistance will be a health equity dashboard. As Rhonda kind of mentioned earlier, a key focus is equity, inclusion, and diversity. This health equity dashboard will include a lot of key social determinant of health information within your service area, broken down by state and national rates and compared against race and other factors within your service area. And this will be compared against information such as your community health needs assessment, what you're currently doing operationally, and we'll have recommendations about how to really help improve the overall population health of your community, including those factors, those socioeconomic and geographic factors, to really improve access and quality of care. And then additionally, one of the key factors of this technical assistance on Stroudwater's side is on the next slide, a pro forma that looks at the shared savings of being involved within some kind of accountable care organization or shared savings program. So it's a very technical in-depth analysis that compares your current status quo position against what is the potential savings of joining an accountable care organization to really help maximize revenue growth over the long term. So we project out into within 5 years and then look at an overall savings of where you're at now versus what an overall shared savings program would look like for the organization. And this is where a lot of good conversation really happens about long-term strategy within our interview and action planning sessions. So a very high-level overview of Stroudwater's portion of the technical assistance, but happy to answer any questions at the end of this or in the chat.
All right, thank you, Cameron. And I will be sharing a little bit more about the timeline for their work versus Stratis's work. So now I'm going to hand it over to Candy Hansen with Stratis to talk about their TA. Candy?
Yeah. Hi, thanks everybody. Welcome. I'm Candy Hansen, and I have actually been with this project. Next year will be my 4th year on this project. So I have very much enjoyed bringing quality technical assistance to the organizations. And so just to be clear, there are 2 tines, if you will, or 2 prongs to the technical assistance. There is the Stroudwater financial technical assistance, and then there is the Stratis quality project technical assistance. And so we are a part of that team. This is our team this year. And our technical assistance team brings years and years of quality improvement experience to this work. So they're very excited to do that. I'm a nurse by background, if I didn't say that. And so on the next slide, we'll just talk about just who Stratis is, if you have not heard of us. We are based in Minnesota, and we have a long history of working locally, regionally, and nationally to support health improvement efforts with rural healthcare organizations and communities. At our core, Stratis Health is a quality improvement organization, and we look forward again to bring this opportunity to bring the background and expertise to this project. Some of the other projects that you might be familiar with are the Rural Quality Improvement Technical Assistance, RHPTP, Rural Health Value, Partnership to Advance Tribal Health, or PATH. And then we also work in the Quality Improvement Network Quality Improvement Organization space with the Centers for Medicaid and Medicare Services. And so those are some of the examples of work that you might be familiar with. And next slide. So in addition to the work that you'll be doing with Stroudwater, again, which has the financial focus, our purpose is working with each of you to provide training and technical assistance tailored to you and your needs to identify, implement, and sustain a quality improvement project of your choosing within one of 4 of the following areas. And I'll show you those tracks in just a second. So the 4 areas are quality improvement itself, infrastructure sort of building, if you will, patient safety, coordination of care, and patient and family experience and engagement. So we'll help you, or we'll assist you at embed and improve a quality improvement whose infrastructure will be hopefully will become your organizational culture by the time we are finished working with you, and as you look to future improvement activities. Next slide. So you'll compare or you'll complete an organizational assessment when we get started in one of those 4 track areas that, again, I'll show you in just a second, with the focus that you've selected that will be used to help identify a technical assistance plan. You'll identify target opportunities for improvement and develop SMART goals, which, if you don't know, are specific, measurable, attainable, relevant, and time-bound. We'll have regular discussions with you based on your facility's availability, but typically it's every 2 weeks at a minimum. Some projects take more intense technical assistance, but we will tailor that to what the needs are to meet the goals of your project. So we'll support your progress, identify resources for you, help you problem solve, and celebrate. And then there is, depending on the organization's needs, there is the potential that our team will do an on-site visit as a part of our technical assistance. And then we'll also work with you on action planning for future improvement efforts. And so Faith will be helping us with the logistics of that. So next slide, here are our 4 tracks. So you can see again, they are quality improvement, patient safety, coordination of care, and patient and family experience and engagement. So you'll be seeing, you'll have more access to this detail when you get the slides, so that you can kind of take a look at that. And then our technical assistance timeline, next slide. And hopefully this lines up with Rhonda's in just a couple of minutes here. But right now, the plan is, I think mid-December, we are looking at doing an introduction and meet and greet call, or a kickoff call, we call it. And then we'll be doing your quality assessment based on the track that you choose. And then about the end of January, quality design plans are finalized. February through August is when our project implementation begins, and that will be again via every other week meetings. And then at the end of August, we will celebrate with you, as well as provide you with a final report showing the progress that you've made from the beginning to the end of the project. And again, if you have questions, we'll take those at the end if we have time. Thank you.
All right. Thank you so much, Candy. So this is just a visual of the kind of the bigger picture of how this all ties together. So down the left column, you can see that the first piece is the project and TA coordination. That's what Angie and Faith and I do, which are coordinating and kind of project managing. And then you'll see financial TA, which is what Stroudwater does, quality TA, which Stratis does, down below the learning collaborative, and help webinars. So what we've done is really tried very hard to not have any 1 month overburdened as far as the demand on your time, because we know that you're busy and many of you also are wearing a lot of hats. So we've already actually got our kickoff webinar on the calendar, and that would be for the hospitals and the clinics that are selected for this cohort. So it'd be the 5 organizations. So that's in October, and then we're going to hit the ground running pretty quickly. We are actually starting earlier than we have in the past, because we want to make sure we maximize our time, because we really only have up till August of 2024 for this technical assistance. And so Stroudwater is going to start right away in October with their introductory meeting with the cohort, or with the individual organizations. They will go ahead and start getting their financial risk assessment, putting out the data request so that they can get that back, because in November, they will facilitate their first virtual almost all day meeting with some of the leaders. It's not everybody the whole time, but those are interviews with some of the leaders, so that they can gather more information on processes and operations in addition to the data they're collecting. Then they will be reviewing the findings and create a draft report in December. And then January, they come back to the organizations and they do a virtual action planning. They read out the final report, and then they facilitate action planning, so that at the end of that time, the organization walks away with a pretty solid implementation plan. At that point, Stroudwater's that formal intense TA is over. They do a 45 and a 90-day post-action planning check-in meeting to see how are things going, what can we do, how can we support you. But at that point, after January, that's where you start actually implementing the action plan. So then we've tried to overlay Stratis's work. So you can see that in December, while Stroudwater is creating their draft report, that's when Stratis starts doing their meet and greets and helps the organizations to just begin to think about what quality improvement project are they wanting to work on. And then the organization submits their assessment. And then in January, they Stratis Health will present kind of the project design and say, this is what we're thinking about, and get the approval and the buy-in from the organization to say, yes, that sounds right, or gosh, can we tweak this a bit? and then it's finalized by the end. And then from February to August, again, that is where they are doing their biweekly meetings. Usually it's a 1 hour thing at a time. And it's just to move you along very slowly on where each meeting builds on the one before. So you can see Stroudwater is really focused on those first 3 months. Stratis goes throughout the whole year. And then we have the virtual learning collaboratives interspersed through there as well. All right, and we will come back to some of that a little bit later. Right now, I'm going to turn it over to Angie LaFlamme to introduce our guest speakers for today. Angie?
Wonderful. Thank you, Rhonda. So I'd like to introduce two wonderful people from last year's RHPT cohort. We have with us today Rachel Boyles. She's the Chief Service Officer with Golden Valley Memorial Healthcare located in Clinton, Missouri. And then Patsy Bachman, who is the Project Manager with Electra Memorial Hospital located in Electra, Texas. And they're both going to share with us today a little bit about their time or their organization's time in the RHPT project, including their project focus, improvements and outcomes made by their organizations during their time in the project, and then as well as some of their next steps in their value-based care journeys. So with that, I'm going to turn things over to Rachel to get us going here.
Awesome. Thank you. Glad to be here. I really want to start the conversation right out of the gate with where our opportunities were and how we determined what steps to take with this. So on that next slide, you'll see we had lots of opportunities, what kind of quality improvement project we wanted to prioritize and kick off. We landed on patient experience. When we started, our baseline performance for inpatient specifically was 60%, a 60% top box, 67% top box. That wasn't something we were satisfied with. We had a lot, as I mentioned, a lot of things we could have chosen to kick off and start with, but that was something we wanted to get our arms around as we were coming off of COVID. We needed to move past. We kept people alive to let's make people feel that they made a good choice coming to use our hospital facilities. So our strategic plan always has a really nice tie-in to service, our service pillar. So patient experience, patient satisfaction is very important to us. And for this particular strategic plan year, we had a goal of increasing our inpatient top box percentage by 2%. And if we go to the next slide, we can share some of those improvement projects and processes that we utilize. I can't speak enough to the benefit of participating in this plan. You can see in 2022 with partnering in this way and taking advantage of these learning opportunities, we really overhauled, we didn't just overhaul, we kind of raised it and rebirthed, regrew our patient experience initiatives. In essence, we never had a patient experience department. I don't imagine that's unique for small facilities. Not many of us have the resources, whether it's FTEs or financial resources to develop that individual unique department. We just wear a lot of hats. From this, we were able to demonstrate a really good ROI that it was important to put a focus on this. So one of the very first things we did and that we continue to do today is develop an organizational patient experience strategic plan, really pulling everyone's efforts together instead of in silos here, there, and everywhere. We were all working on independent things. How can we be more systematic in our approaches so that we can have a bigger impact for our patients? We utilize this in part by implementing the Stratis' auditing tool. They created a really beautiful crosswalk for us. Looking at, we utilize Press-Ganey for our patient satisfaction third-party vendor, and looking at those different questions that the patient provides feedback on. What are some actions that correlate with an improvement? One thing being communication while the patient's in the hospital really has a direct correlation to how are we doing explaining our whiteboards, utilizing our whiteboards, and are we doing hourly rounding with our patients and explaining. So that really kicked off our focus. Those were the two things that we began measuring, auditing, and working with our nurse leaders on. During that, we found there was great value in developing a patient experience coordinator role. We were fortunate to have someone who was an RN who had been teaching a health occupations class in the local high school and retired. And being married to someone in the education system, you get to retire really early. So she still was enthusiastic to work, and she works 3 days a week for us. And her primary role is to, as a clinician, is to support our inpatient, and other nursing departments. So she rounds on patients. While she's rounding on patients, she does whiteboard evaluations. She makes sure that we are completing on the whiteboard. Are we getting in there every hour? And she does in-the-moment coaching with those nursing staff members. It's not punitive. It's set up to be fully, how can we be better together? And it's working really, really well. Additionally, she takes those auditing reports and she meets with nursing leadership at least once a week and says, here are trends, here are things I'm seeing, here's some opportunities, tell me what direction you want me to go next. Last on that 2022, and Candy mentioned this as well, is celebration of milestones. I don't know about you all and your healthcare entities, but we are very quick to maybe fix something or improve something, and then we're looking for the next problem, the next break that needs our attention. We have made a very conscious effort of celebrating when we make those improvements. We actually put that in our 90-day plans as leaders. If we meet this percentage improvement, we will plan a celebration with our teams. We're also encouraging admin team and senior leaders to be involved. Most recently, just this last week, we celebrated our food nutrition services in the 92nd percentile in the nation. All of admin team came with fans. We handed out kettle corn and just made a fun celebration, and our teams loved it. Now this current year, some other things that we've done, we've created the Chief Service Officer role. So that's new. My position is new for our organization. We're also enhancing our patient experience coordinator role to provide education during general nursing orientation, so they know right out of the gate, here's some things we're looking at, here's how you can be great for your patients and improve the patient experience by communicating, leveraging your whiteboards, rounding on your patients in this way. And we have also started to not just stay in that inpatient nursing world, but begun to do some coaching and some auditing, utilizing Stratis' tools in our ED, as well as some of our outpatient areas. And I'd love to show you on the next slide some of our performances. I'll explain to you kind of some things we've done here. You can see the baseline where we started prior to this partnership. You also see a lovely jump on the orange, our inpatient patient experience top box score. That first quarter, those first 3 months after we implemented, we shot off like a rocket and set records for improvement. While we dipped a little bit, we have a smidge of VTAC going on. Overall, from the baseline to where we are currently, we see some continued nice improvement. You can also see that September 22nd, our blue line is our ED. We had such success on the inpatient side, September of 2022, I'm sorry, is when we implemented some of our processes in our ED. Did great. We've fallen off the wagon a little bit the last quarter, but we're starting to make up some ground. So just some good percentages. Inpatient, we've had a 9% increase in top box since initiating our project. Outpatient, we've had a 5% increase since the initiation. ED, we shot up. I actually didn't put in my notes here what our percentage was. It looks like about 9%, 10% improvement. We're going to get back up there. I'm kind of trying to ignore that last quarter where we've been at. Med practice is our physician and nurse practitioner clinics. We really haven't initiated any specific tactics yet. We've just been pretty flat there, but that's the next steps. And then last, before I hop off, just share with you all some additional next steps. I report with the senior leadership team quarterly updates to our patient experience strategic plan. Part of that is to say, here's some areas and departments we're focusing on. I may ask the CNO at your monthly meetings with the ED director, please help with accountability on these particular things. These are initiatives we're working on. We're really working to align our 90-day goals and action plans for our service pillar across the organization. So when folks are developing those, I encourage them to reach out to me. I'll help them make their goals or work together to make sure that, again, we're not working in silos, or we're really working in tandem with our efforts. We're starting to offer skills labs for our nurses. Again, just to continue to reiterate here, those important things that we've learned that will help you be successful from a patient experience standpoint. You see here, we're meeting with our ED nurse leaders, our charge nurses, et cetera, just to help reinforce rounding. We're also implementing some new processes for shift reporting for our patients in the waiting room, so we can keep them some great communication there. One thing I wanted to mention that's not on here, we also updated our Patient Family Advisory Council agenda. We have a small group. We had discontinued PFAC with COVID and really have just started that again in the last 6 months. We always start with a patient experience story to pull them in and let them know, here's what we're working on, here's some of our successes. And our agenda always is pillar based. So we spend a bulk of our time talking in that service pillar. How can we improve our patient experience? And with that, we have various leaders come in and speak of various key actions on the strategic plan that they're responsible for. What we want to transition our culture to is not designing a process that makes sense to us, that will be great for our patients, and getting feedback on the patients after implementation, but really that improved patient-centeredness, where we are asking before we start, this is what we're looking at. Tell us what, I'll give you an example, seamless transition between various settings across our healthcare spectrum. We have all kinds of ideas on what we're going to do to improve that. But yesterday at our PFAC meeting, we said, tell us what that means to you. What does seamless transition look like to you before we build the new process? And so we're really integrating that. And it's been incredibly impactful and helpful. And we're getting some really good buy-in from all of our leaders. So I think that's pretty much it for me. I just, again, want to be thankful and express my thanks for the opportunity to participate in this. Continuing to invest and utilize the resources and tactics that we've been educated on has demonstrated sustainability improvements for our organization that we can replicate in other settings. So it's been incredibly impactful and helpful, and I'm grateful for the opportunity.
Thank you so much, Rachel. I'm going to turn things over to Patsy now.
My name is Patsy Bachman. I serve as the project manager for the Electra Hospital District, more detailed as to Electra Memorial Hospital. Our project focus was starting a patient care coordination program. And I can tell you, just to start off with, that the processes that Candy talked about earlier are very true. I mean, they're with you every step of the way, and that was very, very beneficial for us. We had many benefits from working with them and Stroudwater. The first thing that our hospital did in our journey was to hire a project manager, which is how I began with the organization. The second one was the resources that they provided us. Oh my goodness, anything, anytime we needed, we could pick up the phone and call, schedule a meeting, and especially they checked in with us every other week. And I cannot say one time that they didn't have an answer to give us and something that we had requested needing help with. Third was action plan implementations. They worked with us as well as Stroudwater did too on the financial side of building action plans, how to build them, how to navigate through them. They were extraordinary to help us with that. And like I said, we met every other week, I believe it was, to check our progress. One thing that we did that I would highly recommend is that within our organization, we comprised a team to work each week. We met to see where we're at with each of our action plans. We found it best to form this team work their action plans and be prepared to speak with them every other week. And it went very, very easily and very well. So the accomplishments and the outcomes that we had from our association with Stratis Health and everybody is we developed and embedded an inpatient care coordination program into our hospital processes and systems. By that, we hired a new inpatient coordinator and new clinical educator. Plus, she was a nurse prac. We follow best practices by utilizing the CMS discharge, the CMS social determinants of health questionnaire, and our TMF audit and discharge tool. We purchased Lippincott for our nursing procedures and clinical advisory. Again, this was all with them working with us. We comprised a new patient admission discharge binder, which the hospital really didn't have a very thorough binder to give to the patients upon admission and then when they discharge with their papers to take home. We conducted an ED process evaluation assessment, implementing ED best practices and embedded care coordination support into the ED processes and systems. We designed our EMR note to provide patient history and more efficient discharge instructions for the patients upon discharge from the ED. That was a big improvement for us. Before, it was done more of a manual means of writing it out and sending it to them. So that helped a lot. We purchased online access to EMTALA for the ED group online, which made it easy for those that needed to look at any time. They didn't have to go look for a book, so we did it online. We increased growth in our swing bed admissions and outpatient infusions. That was working with the Stroudwater crew. We started a new inpatient diabetic management program. We revised our diabetic policies and addressed all the diabetic policies except a couple of them that we did have already online, but most of them were new. We held our very first Electro Hospital District Employee Forum. That came along in the means of celebrating and your successes and to everybody to know in the organization what the different clinics are doing, what the different pharmacies are doing. And that was a big push with Stratis Health helping us. We did improve our HCAP scores and through a training event last year of 2022 Q2, we were at 50.68%, and we improved that in the following Q3 to 72.11. And that again was a lot of good work from the group. Our latest accomplishment that we received the top 20 critical access hospitals in the nation award for 2023. And a lot of that was during that timeline that we were, the data they're pulling was when we were working with this group. Next slide. So our next step in our journey is that we continue on with our project management. I truly have a list from different ones in the hospitals that come to me and say, hey, can we look at this? I highly, highly recommend, and I think that was a reason why that things went smoothly, and whether it was me or whoever serves as a project management position, it really did help to make sure that the meetings did take place, to update and be ready for our calls and to get things done. That's just kind of common sense. But so we've started now doing a 340B drug pricing program evaluation. That's a new project. We have a new project coming up to analyze our rehab department processes and billing. We're continue to improve the referral processes and prior authorizations from our outside providers. And we've implemented a traditional Medicare managed care coordination program in all 3 of our rural healthcare clinics with the assistance from Torch and the ACO consultants. And that has been a big program, but it's been wonderful. We have one on the Medicare Advantage that placed nurse navigators with us to work with our team. And then also for the Medicare traditional, these consultants that come in and helped us to, with our own staff, to do the annual wellness visits and all. But Stratis Health along the way had supported us in moving towards those directions and getting to some of the ACO programs. So again, I can't say enough of how much we appreciated. It was step by step. They were always there for us when we needed it. We could call them outside of our weekly meetings. And honestly, like I said, they provided us with so much material and items to get us where we needed to be. I know one time we needed help on a specific project, and was willing to do one-on-one anytime we needed for the extra help. So thank you guys for all your help. And I look forward to seeing all the other hospitals that win the grant. It is really nice. You'll learn a lot from it. It's good. And thank you.
Thank you. Thank you, Patsy and Rachel. It was really such a pleasure to have worked with both of your organizations. We appreciate you sharing a bit about your time with RHPT and, including your progress and some of your accomplishments and early outcomes, your next steps. I think I speak for everyone on the RHPT team that we congratulate you both for really being stellar examples of what's possible for small rural hospitals and clinics. So thank you for joining us today.
Thank you.
So I'm going to jump into some of Patsy and Rachel's. They were part of the 21-22 cohort. That we've got some early outcomes, and I'm sure some of Patsy and Rachel's accomplishments will be listed here. But within the RHPT project, we do what are called recommendation adoption progress calls, or RAP calls, and they are conducted with organizational leadership at both 6 months and 9 months post-project to help support the RHPT follow-up process. And the purpose of the RHPT calls is to assess to the extent a RHPT's organization has adopted consultants' recommendations and best practices and transition strategies. And so the 12-month post-project calls will also include some post-project measurable outcomes. But we also use this time with the organizations to just help them celebrate their successes and to also provide any additional tools or resources that they need as they continue working on their work plans, both in the areas of finance and operations and in their chosen quality focus area. So I'm certainly not going to read through all of these, but we've broken them down into certain areas, some accomplishments and early outcomes around staff engagement, recruitment and retention, education, patient experience, and population health. So a lot of really good things going on here. I'll just touch on a couple of them briefly. One organization had a 20% decrease in staff turnover. One organization now has their community involved in their provider and recruitment process. There's been lots of education implemented in the organizations. Lots of things around patient experience, focusing on golden standards of care and improved HCAP scores, growth in swing bed services, establishing diabetes management programs, just a host of things. And these all are things that they got done during their time within the project or in the first 6 months after their project. So we're excited to continue to follow along with them to see where else that they go. Next slide. Okay, so the application timeline summary. So some of these dates may have been mentioned here and there throughout the presentation so far, but wanted to touch on them once again. So as a reminder that RIPT applications can be completed at any time during the year. However, to be considered for the next project year, which is the 23-24 project year, applications must be received by 11:59 p.m. on August 15th, 2023. 60-minute virtual interviews will be conducted as applications are submitted, and organizations selected to participate in the upcoming project year will be notified by phone and email by late September or early October. And then I think Rhonda mentioned earlier that project activities for those organizations would begin in November. So Tuesday, August 15th, application deadline, end of August. We hope to have all of the interviews completed, late September, early October. Selection announcements will be made. Then October 17th will be the kickoff webinar for the newly selected cohort. And then November 2023 is when the project TA begins, and will run through August 31st of 2024. Next slide. There are 4 ways in which you can apply for the RIPT project. You can apply as a small rural hospital and a certified rural health clinic together, or if you're a hospital that it has 1 or 2 or 3 clinics, so the hospital clinic combo. You can apply as a small rural hospital only, a certified rural health clinic only, or a consortium of certified rural health clinics. So keep that in mind when you're thinking about what would be the right way to apply. And small rural hospitals that have clinics, we encourage you to kind of come in together in this and work hand in hand, side by side on these initiatives. Next slide. So the application review and selection. So all applications are reviewed by the National Rural Health Resource Center. And then each submitted application, like I said earlier, is followed by a 60-minute phone interview with hospital and clinic leadership. And then based on that interview, an overall recommendation will be made concerning the organization's likelihood of benefiting from the RIP Focus TA. And so this is based on organizational need and readiness. And Rhonda referred to that earlier in today's presentation. And then upon completion of the interviews, we will recommend 5 organizations for selection to the Federal Office of Rural Health Policy for the upcoming project year. And when those are approved, then that is when we would go ahead and make announcements. Next slide. There is additional technical assistance that we offer through the RIP project for those who did not get selected, or even those that did get selected, but I'll talk about that a little bit more. So for organizations that are not selected, or maybe who didn't even apply for the project, we do offer a virtual learning collaborative, a 4-part learning collaborative, and this will be open to 20 additional small rural hospitals and certified rural health clinics to participate in, to help promote knowledge base and support readiness for future technical assistance. Those who apply for the project and are not selected will be given priority to fill out those first 20 or the 20 spaces that we have, and anything that's left over, then we would open up to any other eligible RIPT clinic or hospital. We also offer monthly health webinars, health education and learning program webinars on a variety of advanced payment model and value-based care topics. And these webinars are open to all RIPT eligible organizations as well. So whether you are selected to be in the cohort or not, everyone is invited to join us for these monthly webinars. We have a variety of really good topics. For those of you who are not familiar, if you click on you'll get these slides. If you click on the help webinars link here in this slide, it will take you to all of our past webinars, the recording links, and PowerPoint document. So please feel free to look and see what you may have missed, and also what's coming up. We have one more. We have one later this afternoon, and then we have one more in August. So check those out and get registered. We'd love to have you join us for the last two for this year. Next slide. That is all we have for you all today. It's close to the top of the hour. I want to open it up for any questions that anyone may have. You can take yourself off mute or type something in the chat box. We're happy to answer any questions that you have about the project, the technical assistance, the timeline, the selection methodology.
I have a question.
Absolutely.
You said there's 2 cohorts left. So if we don't get selected in this cohort, are we able to apply for the next one?
Absolutely. Yep.
Okay. Thank you.
You're welcome. Any other
Okay.
questions?
It doesn't look like there are any in the chat box.
Okay. All right. Well, please feel free to reach out to any of us on the RIP team. If something comes to mind later, we're happy to answer any questions via email, have a phone call with you. Just make sure that you have all the information you need to know to decide whether or not you feel like this would be a good fit for you. We'd love to have the chance to talk with you and your organizations further. So please don't hesitate to fill out an application. We'll get an interview scheduled and can answer any additional questions at that time as well. Thank you again to Candy, Cameron, and Rachel and Patsy for presenting today and sharing a little bit about their experience and the technical assistance they provide. We appreciate that.
And there is one question in chat that says, is there a contact list with your information?
Could we pull that slide up real quick? It can be found on the RIPT website, and I'll put that in the chat box right now.
Sorry, it was the last slide and I went ahead and took us off of the PowerPoint.